Welcome to Seniors Today's Health Webinar Series. We are here on a bright and sunny Saturday evening, and we are delighted to have here with us Dr. Vishal Khullar. Dr. Khullar is Director of Cardiothoracic Surgery, Heart and Lung Transplants at the Nanavati Max Super-Speciality Hospital in Mumbai. After completion of his super-specialization in cardiac surgery in India, Dr. Khullar honed his skills at some of the world's topmost medical institutions like the Cleveland Clinic Foundation at Cleveland and the Mayo Clinic in Rochester in the United States. Dr. Khullar has performed and participated in over 7,000 successful general cardiac procedures, including bypass, valve replacement, complex surgeries of the aorta, including aorta root replacement, ascending aortic replacement, and aortic arch reconstruction, and heart and lung transplants at these prestigious institutions. As you are aware, Dr. Khullar is the Director of Cardiothoracic Surgery, Heart and Lung Transplants at Nanavati. He has been Senior Registrar Cardiovascular and Thoracic Surgery at the Nayar Hospital, which is TN Medical College in Mumbai. Junior Consultant Adult Cardiac Surgery at the Kokilaben Hospital, again in Mumbai. Associate Consultant Cardiac Surgery at the Hinduja Hospital. Consultant Adult Cardiac Surgery at Bombay Hospital, and Assistant Professor of Surgery, Mayo Clinic School of Medicine, and Senior Associate Consultant, Department of Cardiovascular Surgery at the Mayo Clinic. His education is, if I run into his education degrees and the various things he has done, I must confess, I will run out of time. It'll be 6 o'clock. But I'll just tell you, he has done his MBBS from the BJ Medical College in Pune. He has done his MS in KEM Hospital in Mumbai. He's been at Gangaram Hospital in Delhi, Fortis Hospital in Mumbai, in Delhi, and a host of others in India and abroad. So we are really privileged to have you here with us, Dr. Khullar. Once again, welcome.
Thank you, sir. Thank you for the kind words.
We are in touch with people at the various hospitals and doctors, and we were talking about hypertension and how hypertension causes various issues about the heart. And we thought it would be nice to have you speak about it. So, as always, we have a host of people who have come here and who are watching us on YouTube and various other forums. And I would request all of you who are attending right now over Zoom to send in your questions. And as always, please put in your age and your gender so that Dr. Khullar could give a considered reply. And you can, of course, go through his presentation, and most of your questions would be addressed over there. Answers would be there, but still, over to you, Dr. Khullar.
Thank you, sir. Thank you so much. I'm basically a cardiac surgeon trained at Cleveland Clinic, and then I was a consultant at Mayo Clinic for 3.5 years, and then I decided to come back to India. It's a wonderful journey. It has been a wonderful journey so far. So just a cartoon about how does the heart works. As we all know, there are 4 chambers in the heart. The one on the right side, it's called, I'll take the cursor. So 4 chambers of the heart. The upper 2 chambers are called as atrium. The one on the right side is called right atrium. Sir, can you see the cursor moving?
Yes, we can see it. You can see it.
The one on the right is the right atrium, and on the left is the left atrium, obviously. And then we have lower chambers, which are called as ventricles. So basically, atriums are very receptive. They are distensible. They are very, there is no muscle in the atrium. So their basic role is to receive the blood. So the right side of the body, as you can see, the blue color, it receives the deoxygenated blood from the lower and the upper half of the body. The upper half of the body means the neck and the brain, and the lower half is from the belly and the legs. So the venous deoxygenated blood comes to the right side from the right atrium. It goes to the right ventricle. The lower 2 chambers are called as ventricles, and they are muscular. They are very muscular. The right ventricle then pumps the blood through the pulmonary artery into the lungs. And as we breathe, the blood is oxygenated and then it returns back to the heart through the pulmonary. These are the pulmonary veins. It comes back to the left atrium, the red blood. Now it's red in color because it's rich in oxygen. And then from the left atrium, it goes to the left ventricle. Left ventricle is again a very muscular structure. And because it has to pump the blood through the rest of the body. So, this is the basic anatomy: four chambers, two upper chambers, atrium, two lower chambers, which are muscular, ventricles. And then we have four valves. The one on the right side is the tricuspid valve. The blood goes from the right atrium to the right ventricle through this valve. Then it goes to the lungs through the pulmonary artery. Then there is a valve here, which is called as the pulmonary valve. When the blood comes from the lungs to the left atrium, it is pumped to the left ventricle through a valve, which is called as the mitral valve. And then the left ventricle pumps the blood through the aortic valve into a large vessel, which is called as the aorta. So basically, we'll discuss the anatomy of the heart in detail. Grossly speaking, four chambers, four valves: the mitral, aortic on the left side, tricuspid and pulmonary valves on the right side. So because there are diseases and conditions which will affect the chambers of the heart, they can affect the valves, and there is a big vessel which comes out of the heart, which is called as aorta, which can be affected by various diseases. And then we have coronary arteries, the blood vessels. Like any organ in the body, heart also needs blood supply. So it gets the blood supply through the coronary arteries. These are the first branches of the aorta, and they carry oxygenated blood to the heart. And as we all know, coronary artery disease, many times we discuss बात होती है कि blockage आ गया heart में. So these are the vessels which are affected by the blockage. These are called as the coronary arteries. So just briefly, like we discussed, um, the types of heart diseases, we discussed about valves. Mitral and aortic valves are most commonly affected. Uh, they are affected by a disease called as rheumatic heart disease, or as the age advances, the valves can degenerate over a period of time because they handle a lot of stress. Like aortic valve, in this diagram, if you see, once the ventricle pumps the blood through the aorta, the aortic valve closes. So you know it it has to bear the brunt of the column of the blood, the whole blood which is contained in the aorta. If it starts leaking, the blood will come back to the ventricle, resulting in the ventricle will get dilated over a period of time and the heart can fail. So as the age advances, these valves can degenerate because they handle a lot of stress over the lifetime of a patient. Now, so we discussed about the valves. Then the big artery which arises from the heart, it's called as aorta. This vessel, big vessel, carries blood to the brain and the lower half of the body. It can also, this artery, this big vessel can become aneurysmal. It can dilate over a period of time, and sometimes it can rupture or it can dissect. Then we have coronary artery disease. We discussed about the blood vessels which give blood supply to the heart. There can be fatty deposits in the blood vessels of the heart, resulting in blockage. It's called coronary artery disease, for which angioplasty or bypass surgery is very commonly performed. Then other diseases of the heart, um, like we have electrical wires in our apartments, in our house. Similarly, the heart keeps on beating. Every second it beats. It beats 80 to 90 times in a minute. So it's just the automaticity of the heart, that it beats automatically because there is an electric current inside the heart, like wires in an apartment. There are a conduction electrical axis in the heart. This if you can see this yellow, this all yellow, this is the electrical axis of the heart, which makes it beat every second. So these electrical signals can become disorganized, resulting in cardiac arrhythmias. Arrhythmia means irregular heartbeat. I don't know, you must have heard about irregular heart rhythms, like atrial fibrillation, very commonly seen. Then we have heart failure. The ventricles, which are the muscular organs, the lower two chambers, they're very muscular, but due to certain disease of the heart, they can become dilated, and then they can fail over a period of time. Uh, a lot of advancement now. I have a slide which where you can treat it medically. If medically it's not getting better, then the patient may need surgery. Many people must have heard about an artificial implanting an artificial pump in the ventricle, or even the heart transplant has become so common nowadays. Similarly, one of the diseases where the myocardium, the heart muscle, can become so thick that there is hardly any cavity left in the ventricle. It's all muscle, very small cavity, which can result in heart failure actually and sudden death. It's called HOCM, hypertrophic obstructive cardiomyopathy. It's one of the reasons why you must have heard sudden people dying suddenly nowadays. Can be one of the reasons is HOCM. It's called hypertrophic obstructive cardiomyopathy. And then we have pericarditis. Pericardium is the layer around the heart. The heart is encased in a covering. It's called pericardium. There are certain diseases which can affect the pericardium and cause pericarditis. The covering can become very very thickened, and the heart can fail because of that. The most common cause of pericarditis in our country is tuberculosis. So, type of heart diseases, like we discussed, the coronary artery disease. There can be fatty deposits in the blood vessels of the heart, resulting in blockage. And the treatment options are angioplasty and bypass surgery. Then we discussed about valve diseases. The valve can become stenosed or they can start leaking. The third pathology which can affect the heart is the thoracic aortic aneurysm. The big vessel which comes out of the heart can become dilated aneurysmal. It can rupture or it can dissect. Sir, then we discussed about the cardiac arrhythmias, irregular heartbeat due to disorganized electrical signals inside the heart. Then thickening of the myocardium, which is called as HOCM, one of the causes of sudden cardiac death in young adults, especially athletes. They can suddenly die if this condition is not diagnosed. Then we discussed about pericarditis. The most common cause is tuberculosis in our country. It can constrict the heart. It's called as constrictive pericarditis. And then the heart failure, in which the lower chambers of the heart can become dilated and they can fail over a period of time. Uh, let's go to the next slide. This we already discussed. Now, what is the difference between heart attack and cardiac arrest? So, as the term suggests, the cardiac arrest occurs when the heart malfunctions and stops beating unexpectedly. So, arrest is, something is arrested. It's not beating at all. Total arrest. Uh, Whereas the heart attack occurs when the blood flow to the heart is obstructed or blocked. This typically happens in coronary artery disease when there are fatty deposits in the blood vessels of the heart. Then the blood flow to the heart, to the muscle of the heart, cannot be maintained, resulting in angina, and a patient can have a heart attack. So complete cessation of the electrical activity results in cardiac arrest. Cardiac arrest can happen due to a heart attack, but heart attack is entirely, cardiac arrest is an electrical problem, whereas heart attack is due to obstruction to the blood supply of the heart. We discussed about heart failure, that dilated ventricles. There are a lot of reasons why a heart can fail. Heart can fail after a heart attack. There can be electrical problems. Patients with hypertrophic obstructive cardiomyopathies, HOCM, in those patients, the heart can fail. Uh, Valvular heart disease, if untreated, patients with severe aortic stenosis, severe mitral valve involvement, the heart can fail. Let's discuss about causes and symptoms of heart failure. Uh, I'm sorry. So, you know, the causes of heart failure, it can be a genetic problem. Many times, the main reason, the cardiomyopathies which we discussed, it runs in families. If you have a family history of heart failure, or if somebody has a family history of sudden death in the family, those patients, the family should be screened of any possible, heart defects, or, cardiomyopathies, hypertrophic obstructive cardiomyopathy. The family members should be screened because this disease can run in families. Even coronary artery disease is such a common disease. Genetics is, it's one of the factors which can really affect the blockages. How fast the disease happens. There's so many causes of coronary artery disease, but genetics plays a huge role. If you have a family history of bypass surgery has been done, grandfather, father was operated, you should be careful, because there are things which are under our control, there are things which are not under our control. For example, um, you know how much cholesterol we take, what kind of a diet we take, do we smoke, do we control the hypertension, diabetes mellitus. All these things are under our control, but if you have bad genes, unfortunately, if there is family history of heart disease, these are some of the things which are not in our control. So we can control those factors. um, we can There are certain factors which we can modify, the diet, exercise, diabetes control, cholesterol control, those things that we can do. But advancing age, as the age advances, or if you have a family history, and male gender, these are the risk factor for coronary artery disease. So coming back to the heart failure, genetics, obesity, inactivity, not doing much exercise, high blood pressure uh, is one of the causes of heart failure. Because if you have a high blood pressure, many patients think that, I'll just try to control it with diet or exercise. Lekin, we should understand that uh, if the blood pressure is not controlled, every time the heart beats, it has to, then it is beating against that much higher pressure. Somebody has a normal pressure of 110 by 70, then the heart is relaxed. But if the blood pressure is 200 systolic, the upper blood pressure, then the heart has to beat harder. It has to work very hard. Then other causes of heart failure: smoking, coronary artery disease, heart attacks, heart can fail. Coming to the symptoms of the heart failure, uh, patient can have dizziness, uh, tiredness, history, symptoms of fatigue, shortness of breath, can't walk much, walk. Climbing stairs can be a problem. Everybody gets short of breath when you climb stairs, but unusual, than what is expected, is not a good sign. You should see a doctor. Having palpitation, conscious awareness about one's heartbeat. You can feel that your heart, is beating, or maybe an irregular heartbeat. Those are some of the symptoms of heart failure. Patients can faint. Those are terminal stages of heart failure. Uh, Steps to prevent heart disease. These are factors again which we can modify. All these we should quit smoking. We should monitor the blood pressure. We should take medications. बहुत सारे लोग हमारी कंट्री में सोचते हैं कि if they take medication, then they will get dependent, and the dose will keep on increasing, and they have all the Ayurvedic allopathic medication as side effects. I think that's just a myth. All these drugs are tested. These are, a lot of research is being done. There are n number of publications, and all these drugs are FDA approved, and then only they come to the market. And कभी कभी side effect हो जाते हैं. I mean, then we have alternative medications, but every patient, they should take their heart medication, blood pressure medication. We should watch our cholesterol. In this, I always tell my patients that patient with heart disease, they feel very happy. They will say, oh, my cholesterol is less than 200, so it's normal, so I don't need to take medication. But patients with heart disease, valve replacement was done, bypass surgery was done, or anybody in the family had undergone surgery or angioplasty, excuse me, the LDL cholesterol. See, there different type of cholesterol components: HDL, LDL, VLDL, total cholesterol. LDL is the bad cholesterol. So the level of the LDL cholesterol has to be less than 70 in Asian population. So many people think that the normal level of LDL cholesterol is 100 and mine is bang normal. Mine is 90. So, and that is not true. If you have a family history of heart disease, or if you have even a mild plaque, some blockage in the arteries, the LDL cholesterol has to be less than 70. The goal in Asian population is 55 to 70. Should be less than 70. Regular exercise is a must. Should spend at least 30 minutes to 45 minutes every day. Uh, Eat better, eat healthy, fried food, lot of butter, high cholesterol stuff, saturated fatty acids, or a lot of calories. Even eating nuts, almonds is fine. What are cashew nuts and all those things? Those are not good. They are very rich in cholesterol. They should be avoided. Anybody who's diabetic, or even if you are a non-diabetic, blood sugar should be under control. Taking too much sweets is not good for heart health. Maintain a healthy weight, and like we discussed, quit smoking. Treatment of heart failure, drugs. There are a lot of new drugs which you can take. Uh, Salt intake should be less, because the more salt you take, it will retain water, and that can affect your heart. Maintain a healthy body weight. Change your diet to include more fruits and vegetables, and consult your doctor if you have a history of, or a family history of heart disease. Then surgical treatment. I mean, if you have blockages, then you need angioplasty or bypass surgery. If your valves are diseased, degenerated, then patients may need a valve repair or a valve replacement. Specifically for heart failure, nowadays we have artificial pumps. These are called left ventricular assist devices. And One of the treatment options for advanced heart failure. And then we have heart transplantation. Lot of donations are happening in our country. I'm very proud. Southern part of India, a lot of organ donation drives now, heart and lung transplants. These are cadaveric donation programs, and the heart transplantation and lung transplantation are picking up in our country. Uh, LVADs, it's an artificial pump, and it helps the heart to pump blood uh, when the ventricle is failing. And then we have heart transplant. I would not go into all the details of the heart transplant, but this is one of the options. Uh, then we have, lung diseases. Lung and heart, they both work as one unit. So diseases of the lungs can affect the heart also, and diseases of the heart can affect the lungs. For advanced lung disease, we have option of lung transplants. So it was a short presentation. Uh, we can go into more details. This is my contact number. Please feel free to call me, or you can send me a WhatsApp message if you have any questions, or you need any opinion about your family, friends. If there is any cardiac issue. I'll just go back to my slide about the type of heart diseases. Happy to take questions.
Doctor, can you just give your contact number once again, because I think it you moved. I'll just put it on the chat once you give your contact number once again.
Absolutely.
Yeah. What?
It's 9987740395.
40395. All right.
Actually, if you can Google my name, Dr. Vishal Khullar, Nanavati Hospital, uh, you can go to the Nanavati website. I have another website on my name, and there are a lot of blogs written on the Nanavati website and my website, and about healthy heart, how to take care of your heart after bypass surgery, any valve surgery, what diet you should follow. Um, there are blogs about aortic aneurysm.
I've
Nanavati.
seen your website, doctor. Very, very good and very impressive. And it just shows that the very fact that you've shared your number, you've shared your email address, and it's very heartening to see that uh, top medical professionals like yourself are doing that.
Thank you, sir.
Doctor, can
Sir,
I can I can I go to the
sir,
question directly?
sure, sir. Sir, honestly, sir, when I was in the United States, I
Ji.
thought that the patients are very large. They have a large BMI. So we used to, the heart disease is everywhere. It's so common, all around the world. So I thought maybe it's their diet pattern that, they eat a lot of cheese and high calories the stuff. But when I came back to India, even thin patients I see, I'm surprised to see they have, such severe coronary artery disease, lot of cardiomyopathy, failing hearts, young patients dying suddenly. So I thought I should start a website or something, so that maybe we can educate, our people, our
No,
community.
great. And I'm gonna take the liberty of even suggesting to you that we'll happy to be doing something with seniors today. And because we are, as you see today, we are there are 66 people who have gathered here to hear you and to watch you, as well as there are, we had in all 415 registrations
Right,
until
sir.
12 noon today, and I'm sure there are more. So that's the kind of interest level, and I must tell you that all of them are above the age of 60,
Right, sir. Right, sir.
and they are very vigilant. They are very vigilant, doctor. Somebody is already telling me, okay, now let's get to the questions.
Sure, sir. Sure.
So I will get to the questions. There is somebody who said that I am having a problem of high BP since an early age. Now I am 70 years old. I'm under consultation with cardiologist. My angiogram is all right, shows 20% blocks. My echo is not good, having hardened arteries. I'm giving total, I'm given total of 8 tablets daily to control BP, but it's not in good control. What should I do?
Sir, usually in the young age, I'm sure the cardiologist must have done all the investigations. Uh, I would like to ask, have they checked the kidney? Is the renal arteries okay?
He has not
Sometimes
mentioned. We can ask him to do it.
we should do an ultrasound of the kidneys to make sure the renal arteries, which carry blood supply to the kidneys, is normal. Because sometimes blockage in the renal arteries is one of the causes of high blood pressure in the young patient population. So that should not be missed. Um, um, eight is too many medications just to control the blood pressure. Um, so that we should do an ultrasound of the kidney to make sure the kidneys are all right.
Right. Uh, Doctor, there are a few questions around blood pressure levels as to what is the ideal blood pressure levels for various age groups, starting the age of 60 to 70, 70 to 80, 80 plus.
So, sir, WHO gave the definition of hypertension. The definition was, it used to be if the systolic blood pressure is more than 140 and if the diastolic is more than 90. So 140 by 90 used to be the definition of hypertension, more than that. But recently they have come down to 130 by 80. So anything, even if the diastolic pressure is 86, 84, they call it as mild hypertension, and it doesn't depend upon the age group, the age bracket. Anything more than 130 by 80 is hypertension, is defined as hypertension.
Right. Thank you. There's Mr. Shrikant Kulkarni, who's 71. He says, for a person having chronic AR, how low is diastolic acceptable? Is it okay if it goes as low as 50 or 40?
Sir, usually, so the AR is aortic regurgitation. Remember, we discussed about mitral and aortic valves, which are
Yeah.
present on the left side of the heart. So AR, when we say AR means aortic regurgitation. That means the aortic valve is leaking. So the blood is coming back to the heart. Usually, so there can be regurgitant lesion where the valve is leaky, or there can be stenosis of the valve where the valve has shrunken down. So aortic regurgitation usually is tolerated very well as compared to aortic stenosis. But over a period of time, because the blood is continuously leaking back to the heart, the left ventricle starts distending. It starts dilating, and then eventually it will fail. So I would say that the having a low diastolic blood pressure tells me that the aortic regurgitation is worsening. Excuse me. So there is no such number because the low diastolic pressure is due to low peripheral vascular resistance. So the arteries of the legs are getting, they are uh, they're getting kind of dilated because of aortic regurgitation. So I would say any patient, if the echo, there are certain criterias which we follow, which we see on echo when we say that, oh, this patient has severe aortic regurgitation. If the patient has severe aortic regurgitation, the valve is leaking badly, surgery should be done because the ventricle will distend and eventually the heart will fail. If you have symptoms of shortness of breath and you have severe aortic regurgitation, irrespective of diastolic blood pressure, the patient needs surgery.
Thank you. We have a question from Mr. Anil Kumar Chopra, who's 73. He asks, what are the symptoms of blockage? How can it be diagnosed early stage? And is it essential to take ecosprin if suffering from high BP or diabetes?
Yes. So coming to the first question, the symptoms of coronary artery disease blockages is the typical symptom is angina, which is called chest pain radiating to the left arm. But there are so many different presentations of this disease. Um, you can have chest pain radiating to the throat, to the jaw, radiating to the left arm, even radiation of pain to the right arm. Epigastric pain means pain in the belly, in the stomach. Many patients think that, oh, it's just acidity. I should stay at home. I'll take the one of the acidity medications and I'll be fine. So pain radiating to the back. Um, Many patients are asymptomatic. If you are diabetic, you can have silent heart attacks. So there are 10 different presentations of this disease I see every day. रात को सोए थे, सुबह उठे ही नहीं. Young patients dying suddenly. Then you see patient coming to the emergency department with a massive heart attack. There's so many symptoms. That's first question. The second question was, is it mandatory to take ecosprin if you have high blood pressure and diabetes mellitus? So it's not mandatory to take ecosprin, but generally speaking, if your age is more than 70, taking low dose aspirin, which is 75 milligram a dose, will always be beneficial. It will not do any harm. So the aspirin is a painkiller. Uh, Generally, when we prescribe aspirin for pain, the dose is 300 milligram. But for heart diseases, the blockages and all, the dose is 75 milligrams. And there is no harm in taking aspirin if you are diabetes. Yes, there is no indication if you are young, but age more than 70 years, it's very beneficial because diabetes patients will have some kind of blockages. It's very important to understand, sir, that angina is different. Having blockages doesn't mean necessary 100%. That many patients think that, oh, I have only 50% blockage, so there is no risk of heart attack. If I have a 90% blockage, then there is a more risk of heart attack. It doesn't work like that. The heart attack happens because the blockage inside the blood vessel, it ruptures. When it ruptures, it causes blockade of the blood supply to the heart. So even if you have 40% blockage, it's a risk factor for having a heart attack. So aspirin will be helpful, especially in diabetic patients. Yes.
Right. Thank you, Doctor. Doctor, this is an interesting question. Uh, Doctor, every time I hear the news, and if there's some unpleasant news, I start getting palpitations. Like yesterday, when there was this news about the 2,000 rupees being withdrawn, I started getting palpitations. And not that I have too much of money, but still, I find that negative news has a very bad impact on me. What should I do?
So how old is the
He hasn't mentioned his age, but I'm sure he's a senior citizen.
because see, sir, if it's a young person and there's no underlying heart disease, then it's a normal response. Everybody's different. Some people can get stressed up, small issues, they can have palpitations. But I would say if there is any underlying, you know, disease like blood pressure, diabetes, or if your age is more than 45, 50 years and you are having palpitations due to any reason, then it should be investigated.
Right. Thank you. We have a question from Katie Dadanchi. Doctor, I have read that bypass surgery can be done with a small cut under the rib cage. Is it true as it is a less invasive surgery?
That's true. Yes, it can be done. You can cut open the rib cage, and it is very much. There are not too many people who are trained yet, but many of the cardiac surgeons they are trying to do a minimally invasive procedure.
And another question that she asks is that we were told that more than cholesterol, we should lessen triglyceride, as that causes heart attacks. Is that true?
I'm sorry. What?
More than cholesterol is triglyceride that is a bigger evil. Is that true?
So that's not true because triglycerides causes peripheral vascular disease, whereas the peripheral vascular disease means blockage in the leg arteries, whereas high cholesterol is bad for the heart, and LDL is the bad cholesterol, like I said. HDL is good.
Right. Thank you. We have a question from Mr. Bharat Mehta, who is 66. He was operated for main artery angioplasty in October 2020. His question is, what are the chances of blockages again, even after medication taken thereafter, and what precaution should one take to stop further damage of the heart?
So, sir, he underwent angioplasty, correct? Not surgery.
That's right.
And that was for left main coronary artery disease. You said left main.
That's right.
Is the patient diabetic, sir?
Well, he hasn't mentioned. He was operated for the main artery angioplasty during October 2020, is what he said. He hasn't mentioned whether he is diabetic or not.
Sir, if the blockage was more than 50% and the patient was diabetic, then surgery is more beneficial in the long term.
Right.
If the blockage is less than 50% and patient is non-diabetic, then left main angioplasty can be done.
Right.
There are a lot of factors which can contribute uh, to the long-term outcomes, depending upon um, what were the angiography findings. For that, I will have to see the angiography and angioplasty CD. Then only I can answer that question. Uh, I'm sure in addition to the left main, there would have been multiple other blockages in the heart. It's not very uncommon. Isolated left main disease is not that common.
He
So,
has another question, doctor. His second question is, if I need to go in for a myectomy, what is a center of excellence in India which performs myectomies regularly?
that's a good question, sir, because there are very few surgeons who are trained in myectomy in India. Uh, Honestly, I have a close friend actually who needs a myectomy. I mean, eventually he will need a myectomy. We are giving him medications, and even I am looking for a surgeon who can do a good myectomy. You know, I will have to find it out, sir. Sorry. I can't answer. Even
Right.
I'm looking for my friend.
So those of you who are, if you have a specific question, uh, like this, you can just write to Dr.
Yes.
Khullar. You have his email address. Uh,
Please remind me. I can ask around. In my, I can ask my colleagues all over India. The cardiac surgeons, and ask them who is the best. Um, yeah, it's
this
a very
is
niche area, and not many people do myectomies. Yeah.
right. We have an anonymous attendee who's male 70. He says he has had a stent put 3 years ago, and he wants to know, does he need to take an Ecospin 75 and Roosevelt tablet 5 mg lifelong? Or can the daily dose be reduced to 2 or 3 times per week?
Oh no, sir, absolutely. Lifelong aspirin and rosuvastatin. And that also, like I said, the goal LDL has to be between 55 to 70. Lifelong.
Uh, Doctor, we're running out of time, but I'll just take 5 more minutes if you don't mind.
No
Uh,
problem.
we have a question from Marjorie Fernandez. She says she had an open heart surgery 3 months back, which involved replacement of the mitral valve and LA application and septal myomectomy. The surgery was okay, but her pulse rate has increased a lot. She feels breathless even with walking from one room to another, as it raises the rate from 95 to 100. Only when I sit down can my pulse rate be reduced to 80 or less. I am taking Metalor 25 for my problem, but it's of not much help. I've been told that this high pulse rate has no connection with my surgery. Is this true? And what can I do to reduce my pulse rate and not feel breathless? She says that she's forgotten to mention that she doesn't have any blockages in her heart, and also she seems to be suffering from ILD, which makes her breathless, and she has to take medicines, including steroids. But it's only for 2 months or so for the Delhi winter. She is fine in the rest of the year and don't take any medicines. She is 76, and otherwise she says she's blessed with fairly good health.
So, sir, mostly I think the reason for shortness of breath is the interstitial lung disease. Nothing to worry. If her heart rate is on the higher side, and that can be controlled with the beta blockers. So they can increase the dose of metoprolol, which she's already on.
Right.
The
Uh,
dose of metoprolol should be increased. No worries, she'll be fine.
Uh, Doctor, there are some questions which I've been asking about uh, uh, alternative medicines that are there. You have, of course, spoken about the fact that the allopathic school of medicines are tried and tested. There's a lot of clinical research. But what is your broad advice to people who might look at some alternative medication?
So, I believe that ultimately, all these medications, they act on the receptors inside our body, correct? We have receptors at the cellular level where they act. So even if you take allopathy, homeopathic, Ayurvedic, whatever medication, ultimately they have the same molecule which is going to act on the same receptors. The only difference between allopathy and other branches are sciences is that we have done a lot of research, and after that only we have come up with these molecules with particular dose. We know how much dose needs to be given. um, I would like to um, I believe in allopathic medication, and because it's tested, there's a lot of research which is done. But I believe in yoga. There's a lot of research done on yoga. I don't know much about homeopathic and Ayurvedic, but I think ultimately they act on the same receptors.
So, Doctor, I'm sure you have a crazy schedule which you have for yourself, with all your surgeries, etc. And plus, there's a lot of stress with every patient that you have. How does Dr. Vishal Khullar keep himself fit with a pretty horrible schedule?
Sir, I do yoga every morning. I wake up at 5 a.m. in the morning. I go to gymnasium. I spend 45 minutes there, and then I spend 35 minutes. I do meditation.
Wow. And you must be having a fairly punishing schedule otherwise rest of the day.
It is busy, sir. Yes. It is very busy. It's a lot of responsibility, sir.
Doctor, we'll take one last question, and there are quite a few questions that have come in. What we'll do is we will just look at them and have it sent to your office, and perhaps if you find some of them worth responding to. I'm not taking specific questions which
No
are
problem.
mentioning specific drugs. There's one question which is important. Is there's many doctors in India and abroad nowadays advised to stop blood pressure medication. Is that normal?
No, sir. Should not be stopped. Blood pressure medication should not be stopped. Suddenly, patient can go into pulmonary edema, means the lungs can fill with water, heart can fail, patient can have stroke, paralysis. Um, it should never be stopped, sir. Blood pressure medication. I wouldn't recommend that.
Right. Thank you very much for being here. You've spent so much time here. Unfortunately, we have some 10 odd questions which are there right now from
Thank
Mr.
you, sir.
Sudeep Srivastava, an anonymous attendee, Mr. S.K. Agarwal, Mr. Somesh Java, Pushpa Shahji, Shrikant Kulkarni, Mr. Vish Duggal. We will send these questions to Dr. Khullar because obviously we need to also look at the time. Thank you very much again, Dr. Khullar, for taking time for an excellent presentation and for really patiently, answering all the questions, and of course, sharing all your coordinates so that people can get in touch with you directly. To all of you, as always, we will be putting up this video on Monday, as well as the takeaways from this session, which, as you know, are written by a medical practitioner who takes the sum and substance of this presentation, of this Q&A session, and they will be put up on Monday. So you can see that. And as always, we will be there next week at 5 p.m. You can set your watch as per the time that we start the session. We always start on time. In the chat window, you have a link which has been put up about the pre-registration for our health webinar sessions. And please feel free to do so you don't have to really wait for our announcements. Doctor, if you don't mind, I'll just request you to have a look at one video, which is our latest issue of the magazine, which has just been out, and it's interesting. Doctor, before, as our producer brings this up, just to tell you, Seniors Today has been there for the last 4 years. We're going to complete our 4th anniversary in July. Before the lockdown happened, we took a bet that our seniors are fairly technically initiated. So our magazine is only available as an e-magazine. It's not a print magazine, and it's available free of cost. And we've just published our 47th issue in the month of May. And Feroz, can you put on the video if you don't mind? So we have a host of people who write for us. Some really well-known writers. Even if I try and plug my own magazine. Thank you for watching this, Doctor. As you see, our cover story is talking about what do people do, and the whole thing about keeping the marriage warm. For people who have been married for 40 years, 50 years, 60 years, how do you ensure that there is some excitement in the marriage which is there? So we are looking at fairly relevant issues for the senior citizen of today. It's not just about pensions and those kind of articles. We are looking at lifestyle issues that are there in the magazine. Thank you very much, Dr. Khullar, once again. Thank you to the team at Nanavati Max Hospital for facilitating this. And goodbye, and see you again at 5 p.m. next Saturday.
Thank you, sir.
Subscribe now and press the bell icon. Never miss an update.